Oh, I just realized that I was on mute for the intro there. Good afternoon, everyone. My name is Mark Fetterhoff, and I am happy to welcome you to today's presentation on current Medicare scams. This is put on by the Elder Watch program, and we are doing a bunch of different presentations leading up to the end of 2020 on different ways of staying safe and avoiding frauds and scams. As part of Elder Watch and with some of our partner organizations. You can see that link on the screen right now. That link is to sign up for the different types of presentations. All of the presentations that we are doing as part of this event are being recorded and will be used for people who aren't able to join us live. But we're happy that you're able to join us today, and hopefully you'll be able to share this with other folks. This presentation will be on our YouTube link later in the week. I'm just trying to. There we go. So today we are going to be talking about Medicare scams. I'm very happy to welcome Kim Latta, who's with the Colorado Department of Regulatory Agencies, and Kim is the one who manages the Senior Medicare Patrol Program as well as the SHIP program within the Division of Insurance there. Welcome, Kim. How are you today?
I'm good. Thanks for having me.
Thanks for being here, Kim. And this is the second presentation that Kim has done with us. The first one, we talked about Medicare open enrollment. And before we go down the road of Medicare scams, since we still are more or less knee-deep in open enrollment, I was wondering, Kim, if you would just, let people know on the call what open enrollment is and what older Coloradans should be expecting during this time.
Sure. So as you know, we're right in the middle of a Medicare open enrollment, which is when beneficiaries have a chance to change their coverage for next year. And because this kind of coincides with the COVID pandemic, what we're watching for most importantly right now is those unsolicited calls or people knocking at your door trying to sell you insurance. So they can mail you publications and information about their plans. They can email you unsolicited, but they can't call or text unless you've given them permission to do that. And they can't just show up at your door unsolicited and ask for a meeting with you. So those are the things we're watching for most closely right now.
That's great information to know. Has your agency received any types of reports from Coloradans about any of these unsolicited communications during open enrollment so far?
So we have received a couple, and we did receive a few when the shutdown happened first, in the spring for COVID. So, I just keep watching, but it would be the most obvious time for it to happen now, because those folks who sell insurance are used to being able to have access to beneficiaries. So you would have events, right, and do educational events or marketing events of some type. Well, with most groups not being allowed right now, or people not feeling safe to do that, the next most obvious thing is to go to where people are, and that is they're at home. So I feel like just because we haven't received them, maybe people didn't know where to report it to or tell us about it, but I'm pretty sure it's probably happening. If we're receiving a few calls, it's probably happening a lot more than that.
Yeah, that's a good point. And I also think that, we continue to hear on the Elder Watch helpline about different types of Medicare scams that are bubbling up this time. And I think because it is open enrollment and communication is up from different insurance companies, it opens the door to other Medicare scams. Do you think that's correct?
Sure. They're going to take any obvious thing that's going on in the news, right? So we watch that happen all the time. They'll take advantage of something. And because it's now open enrollment, they know people are looking for information about plans that might offer them better coverage in 2021. So they're taking that as the chance to get them to talk to them, right? They'll call them and say, don't you want to hear about this information? Or they'll show up at their door and say, let me tell about you. You could save money. So this is another opportunity for scammers too, or those who aren't being entirely on the up and up to get into your life, right? To have a conversation with you.
Yeah, I think it's great to just make sure people are on alert during this time because, you know, and your points are great, and it's great knowing that someone shouldn't be showing up at your door because we're sure that type of thing is happening out there, and people, again, like you said, are probably not reporting it. So really great information. Kim, I talked to someone yesterday who called the helpline, and they received an unsolicited call about a back brace. And the woman told me that she was very concerned because she thought that the scammer who talked to her had her personal information because she did have lower back pain that she dealt with a couple of years back. What can you tell us about these type of scams?
Well, so they're going to say things that make you feel like they already have your information or they already have been given permission to reach out to you by a healthcare practitioner or something like that. But in truth, you know, how many of us have lower back pain, right? And as we age, we more likely have lower back pain. And so that's just a way for them to, you know, kind of open up that conversation. They're very good at finding something that looks like they're concerned about you. And so I would think most of us could say at some point in our life we had lower back pain. So that doesn't mean they have your information. I know it's a bit scary to think about that, but probably they just have a list of numbers to call.
I was going to say the chair that I'm sitting in right now, if I sit in it for too long during the workday, I sometimes get some lower back pain. So I really appreciate that comment based upon what you're saying, because and that's essentially what I told the person who was reporting it. It's the low-hanging fruit. You know, they're using different types of ailments that older adults might be dealing with, or any type of adult might be dealing with in terms of the scams.
Sure. Yeah. And the risk of taking an unsolicited piece of equipment from them and giving them your Medicare number is that they're billing your Medicare for it. It may or may not even work for you when it gets there. It's going to be an off-the-shelf product that probably isn't going to fit well, whatever kind of brace it is, or that just seems to be the equipment of choice right now. But some kind of brace they'll send you in the mail. They're going to bill your insurance. And then if you really needed a custom piece of equipment and went to your doctor and had a prescription written for it and put in for it, Medicare could come back and say, you know, we already bought you one of those and we paid for it. So I would just say don't take that that solicitation of have something free just because it's no cost to you, somebody's paying for it. And anytime you give your Medicare number or someone's asking for your Medicare number, they intend to bill your insurance. So not only would it come to you and not be useful potentially now when you really did need one that really did work for you, you might end up paying for it because your insurance had already paid for this unsolicited off-the-shelf model.
And I think that point that you bring up, particularly about the fact that if you do need that product down the line and then you can't get it because they already said that one was given to you, is a really good point that people don't think about, particularly when these scams come up, because I think a lot of people think, oh, well, what's the harm, right?
Right. But the harm is, yeah, right. The harm is that your insurance is going to pay for something that isn't going to be useful to you. So just think about any time Medicare's paying for something, it's somebody saying it's medically necessary for you. And so who's doing that? Well, somebody posing as a healthcare practitioner, somebody who really is, who's in on the scam, somebody's saying you need it. So a good thing to do anytime you need any kind of equipment or supplies is to just contact your regular doctor, let them write you a prescription for it, let them help you get connected with a provider that's for these supplies that's, that they know and trust and all of that. So just not answering these unsolicited, whether it be on your TV, your phone ringing, somebody at your door, trying to sell you these things you didn't ask for. Just be cautious of that always.
I think that's great advice. How much have you heard of before that these scammers then turn around and charge Medicare for this equipment?
Oh, well, almost always, because that's the reason they're doing it, right? They're sending it to you, usually unsolicited, and it doesn't stop. We have consumers that get not one brace, but 2 or 5 or 7, right? So once they figure out this works, and so they could do something for every part of your body, potentially, once they have that Medicare number, then they're free to just, submit claims against it and send you whatever they want. Sometimes they send it, sometimes they don't. Sometimes they send things, most often they send things that aren't useful. So the way you would figure that out is if you've given the number, I'm almost guaranteed at some point they're going to bill Medicare for it. If you watch your statements, you'll see what's been billed against your Medicare number, and you could notify somebody, Medicare or, the Senior Medicare Patrol Program, and tell them they're billing for things either you didn't ask for or didn't receive.
And we've had a quick question come in from the audience pertaining to what we're talking about. So what if you make this mistake and you receive one of these products in the mail, you realize later that it was a mistake? What should you do?
Well, so the challenge is once you accept it, it's hard to get it returned. So the best thing you can do is refuse it, right, when it comes to you. If it's something you don't recognize, you didn't order, you just refuse it so that it's not your responsibility to return it. But if you've already taken it, then the challenge is, who do I send it back to? You may or may not have paperwork or a phone number to call. Maybe they don't even answer the phone call to tell you how to return it because they don't want you to return it, right? So if you have a place to return it to, you can, but most likely then the postage is on you. And if you want to prove that you've returned it, then that costs even more money. So the challenge is, once you've accepted it, do you want to spend more money to give it back? And do you even know who to send it to or where to send it to?
So it sounds like the best thing you can do is recognize it right away, and if you did make that mistake, refuse it, and then otherwise you kind of have to sort it out as you go depending on the circumstance.
Right. So just looking at that, any package that comes to you that you didn't ask for, just don't even take it. Yeah.
Another question about a Medicare scam that we have heard about specifically over the last year, and even more so last year, were those DNA test kit scams. And I was wondering if you could talk just a little bit about that scam and how that works.
So back then, that was people camping out in all different kind of sites where they think older adults would come to or cross by. I mean, we even saw them on the sidewalk outside our building downtown Denver. But it happened in parking lots. It happened in front of buildings. It happened in the back of people's trucks. It happened in senior living places. It happened everywhere you can imagine in the nation. So wherever I saw it at a home show in Boulder County, so they wanted to swab your cheek and then send it in. So some of them were sold as, do you have somebody in your family who's had cancer? And we can swab to find out, what your chances are of getting cancer. That's kind of the most billable message, I think, that people just bought into and really thought, gosh, if I could find that out and I don't have to pay for it, they're going to bill my insurance. But it was way more complex than that. Sometimes there has to be, again, medical necessity for this. So there was some practitioner that either was doing it, so that was billed as well for their time. But usually people ended up paying for the test itself with cash, right? Paying for it because it didn't get covered. So somewhere along the way in the conversation you were told, oh, it doesn't look, your insurance is going to pay for this. And then people by then were sold, right? They thought they needed it. They thought it would, it would help them be safe and all of that. So that was really prevalent everywhere in the nation. Then it kind of got better and we didn't see so many calls on that, but now it's morphed into something related to COVID. So now they're saying we want to do these tests to figure out whether you've had COVID, whether you are going to get COVID, whether you've have it now. And so these tests are so much the genetic related to cancer in the conversation. They're now related to COVID. So they're starting to surface again. And I imagine as soon as we get a vaccine release, there's going to be a ton of stuff around that as well, trying to get people early access to vaccines.
Well, that's a great point. I hadn't even thought about potential scams that might start coming as a result of the vaccine. Have there been, things that Medicare or the Division of Insurance has been looking at specifically that they're concerned about with regards to, vaccination scams that are going to start bubbling up soon?
Well, we're just nationally, we've been talking about it for a while because after we saw the testing, it's okay. Well, it's the next obvious things. As soon as they start talking about vaccines in the news, then people are going to be anxious to have that, and they're going to then respond to someone contacting them and saying, "Let me help you get access to a vaccine." So again, all that information. If someone's contacting you out of the blue, nobody does that legitimately. You can, if you're in tune with your county health department, and you get maybe texts or emails or something from them, that's a whole different thing. But it could be because you signed up for that, right? And you know the source. But if people just start calling you or knocking on your door, offering you, access to a vaccine, those are all fraudulent.
Great advice and great information about what we should be looking out for, because I think that you're exactly right, and we'll keep talking, between DORA and AARP and the Attorney General's office about these scams, so we know when they're bubbling up and we can make sure to alert people as they bubble up across Colorado. Another question that came in recently, Kim, there have been rumors and scammers using new Medicare cards as a potential way of trying to get people's information, and one that really popped up recently is one about a Medicare card with a chip in it. Can you talk anything about that? Have you heard anything about those types of scams?
So nationally, we have heard of that going on in other states. We have not received calls in Colorado about this, but it's always a possibility, right? Anything that works, and if it works in one state, they're going to move it to another state, right? So we watch carefully what's going on around us in other states, even if it's not happening in Colorado, because if it's in a neighboring state, it'll just be a matter of time before it shows up here. And they'll just keep doing anything that works. So we have heard from other states that there are unsolicited calls going to people saying that they're going to get a new Medicare card with a chip in it. That's not true. Your Medicare card does not expire. The one and only time ever that I've heard of Medicare cards being replaced was a couple of years ago when you all got brand new cards with a new number on it to be more protected. They moved away from the numbers that included a Social Security number embedded in it, right? And they've moved to a different number. And so everybody got cards. New cards, but that's the only time I've ever heard. And then, of course, if you lost your card and you get a replacement card, you could get a new card in the mail. But it's, again, you requesting it, right? I've lost it. More likely, you just go on to your My Medicare account and print a new card. You wouldn't have a new card sent to you. So the paper card that you got is the only card you're going to get, and there is not a new plastic one that looks a lot like a credit card with a chip in it. That's not coming. And anybody who says that there is one, they're trying to get you to give them personal information. Typically, they ask for your Medicare number to verify before they mail it to you. And again, the government's not doing that, and that's not a legitimate call.
And Kim, would you recommend that people, just on an everyday basis, carry their Medicare card in their wallet?
I don't think it's a great idea. I think that when there used to be more live events going on, I think it was hard for people when they would go to, say, a senior event and someone would say, "Oh, are you on Medicare?" It was interesting to watch. A lot of folks would just pull out their Medicare card automatically to show someone, "Yes, I'm on Medicare." And we want to be legitimate, we want to be helpful, and we want to answer people's questions and all of that. So we automatically respond like that. And so it's not an ID card. You shouldn't have to show it to anybody to prove anything. It's an insurance card, right? So unless you need insurance, you don't need the card. And once you show it to your provider the first time, they have it. You don't need to keep showing it to them. They might ask for it just as part of their process, but you don't have to show it to them because they already know it. And the most common example is people say, well, what if something happens? What if I'm in a car accident? The truth is there are ways for those medical providers to get your information. And so it's okay. It's not like you're going to be denied services if you don't have it with you on your person. So I'd say you're less likely to get it out inappropriately, just out of habit or in conversation if you don't have it with you. So I would say you don't need to carry it with you all the time. If you want to, I understand that, but that's my recommendation is not. So.
Well, I appreciate that information because I would say then, particularly when we're doing live presentations, that's one of the most common questions I get is, what should I be carrying in my wallet? And I typically like to give the same rationale, but I think you make some really good points in terms of again, why you should not be carrying that type of card in your wallet, because it is very valuable for a scammer, correct?
It is. It is.
Kim, can you tell me just a little bit, you really manage some critical programs in the state of Colorado, and can you tell me why someone should call Senior Medicare Patrol, or what instances most people are calling Senior Medicare Patrol about, and also same with SHIP as well?
Right. So let's start with SHIP because it's a little more general. So just like now we're doing open enrollment and folks want information about what plans are available to me, they can call and get that information free of charge from us. This is a government-funded program. All states have federal grant money, and a lot of the services are provided by trained volunteer counselors. So we're always available and ready to give you neutral, unbiased information at no cost to you. So year-round. Especially important right now during open enrollment when people are trying to decide whether they need to change their coverage for next year. On the Senior Medicare Patrol side, we really want to hear about things that people do that seem inappropriate, right? So are they calling you and asking you for personal information? Are they trying to give you something you didn't ask for and bill your Medicare for it? Is there an insurance agent that's doing something inappropriate, inviting themselves into your home, not leaving till you sign on the line and give them a check? All of these things that just kind of send a red flag up for you that you think, gosh, I don't know, should somebody really be doing that related to insurance? We want to hear about that at the Division of Insurance. And if it's Medicare related, we specifically want to hear about anything that that was done inappropriately. Could have been by your provider, that maybe they only provided you with one level of service, but when you saw your Medicare summary notice, it looks like, well, they provided a higher level of service that costs more money. That's called upcoding, where they, give you one thing and charge for the more expensive thing when they bill your insurance. All of those things we want to hear about at Senior Medicare Patrol.
And you bring up that point about the upbilling or upcoding. Would you talk just a little bit more about when people receive their Medicare statements, what they should be looking for in terms of that type of thing? We haven't talked about that very much before, and I think that's an important point to bring up.
So I would just say to write down when you receive services that are going to get billed to your insurance, whether you go to a doctor's appointment or it's some kind of prescription that you pick up or is delivered to you, or if it's some kind of equipment or supplies that your Medicare is paying for, or you've had therapy or whatever it is, just keep a record of that. And then when you get your Medicare summary notices, and you could get them in the mail quarterly, or they could come in a different way if you have a managed care plan, but you get a record of that some way. Or if you decide to do it electronically, it could be on your My Medicare account, and you could get access to it more frequently. But in some way, you should just look to see what was billed against your insurance, to match it to what actually happened. So if they're billing for services provided by somebody you've never heard of, or on that date, you weren't even here, say you were, out of state, or you didn't leave your house or whatever, and something happened, those are the kind of things that we want to hear about. And honestly, there's hardly any other way for us to figure that out if it's not for the beneficiary calling us and saying that did not happen, right? I did not receive that service. It's really hard to figure it out. And then we can take that one instance, track back to whoever was doing the billing or the provider, and say, did this happen on other occasions? And that's when it grows into a case that can maybe be prosecuted, right? But so just keeping track of what you received and what your insurance got. And you might say, well, so if I didn't have anything to pay, right, because my insurance covered it, maybe you had original Medicare and a supplement, or you had your prescription drug plan or whatever, and maybe you didn't owe anything for it, but still somebody paid for it, right? Still the government paid for it. And so when I tell people, when we watch what we pay for premiums on insurance or what our out-of-pocket costs, all that is directly related to what's paid out in claims. So whenever we can protect fraudulent claims from being paid, it's a win for everybody.
Excellent advice on checking that statement. There is one more question that came in. It says, I see many, no-cost or low-cost Medicare supplements now. I thought it was usually a couple $100 a month for these supplements. Has something changed?
So let me just talk about the word supplement a minute. So people use it really broadly. They use it to describe something that's in addition to their Medicare, right? Some coverage beyond their Medicare. A true Medicare supplement, or often called a Medigap plan, right, is not going to be that you're hearing about right now, because open enrollment is not a time for people to buy Medicare supplements. There's sort of an ongoing opportunity. We won't get into the complexity of that, but just know that's not a supplement. And so when we get people complaining, they don't even really know if they have a real supplement or not. These plans that I think you're talking about are Medicare Advantage plans, and these are a managed care plan that actually replaces your Medicare. So there's an agreement between the federal government, CMS, Centers for Medicare and Medicaid Services, with these private insurance companies to provide your services. So they're not really supplements in the sense of what you're describing. So those, and I would just say one thing on those two. When you see those commercials, be very careful when they talk about zero premium, because just because there might be a zero premium doesn't mean there's zero out of pocket. So there's pieces and parts to your out of pocket. First is your premium that you pay monthly, right? Then there's often a deductible depending on what kind of service is being covered. And then there are co-pays and co-insurances after that. So all those things are your out of pocket costs. And so just be really careful when they're focused on one of them being zero, because what we're noticing is maybe the premiums have gone down in the last few years, so there's less paid up front, but the total out-of-pocket has not. So just be careful with those words and how they're using them.
That's great advice, and clearly, Medicare can be a complicated subject, and we're so lucky to have Kim here to answer these difficult questions, because it is something that a lot of people struggle with, and having your advice is very valuable here. Up on the screen, I have information about how to get a hold of AARP Elder Watch, as well as the Stop Fraud Colorado website. I also have the phone numbers for Kim's department within the Division of Insurance at DORA, as well as the phone numbers for SHIP and Senior Medicare Patrol, as well as Medicare.gov. Again, Thank you so much for joining today's call, and a special thank you to Kim for her partnership in educating older Coloradans about Medicare and scams and getting good information about Medicare. And we look forward to seeing you all for the next presentation. Have a great rest of the day.